We're here at My Choice Primary Care. Thanks for joining us and our guest, Dr. Parveen Vahora. She's a board-certified OBGYN who's practicing in Trinity as a gynecologist, doing minimally invasive surgery. But outside of that, connecting with you, connecting with patients, making a difference, listening. So today we were hoping that you could talk to us a little bit about how important it is to support our female patients that are entering perimenopause. Everybody talks about menopause. What about perimenopause?
Thank you so much for having me here, Teresa, and I'm excited to be part of your programming today. Women nowadays are having many symptoms in perimenopause and menopause, and it's very exciting that finally we're learning to treat perimenopause. So perimenopause can be a period of time that can happen for maybe 2, 5, even up to 10 years prior to menopause, and women can have symptoms, and those symptoms can range from hot flashes, mood swings, irritability, muscle aches, joint pain, weight gain, a whole host, even brain fog and sleep disturbances. And now, according to the Menopause Society, we are treating these patients, and women need to talk to their physicians, their healthcare providers, and tell them symptoms, and then we can evaluate them and treat them.
Very good. And how do you manage when a patient comes to you and says, I'm absolutely not doing hormones because it's going to kill me with breast cancer? I have breast cancer in my family. I'm not doing this.
Well, every patient that comes to me, we take a full approach, listening to all of their symptoms. If they have a family history of breast cancer, we talk to them about genetic testing because we want to know what the risk is, right? Are they BRCA positive? Do they have a high risk for breast cancer? Or do they have a moderate risk or a very minimal risk? So everything is based on the individual person, and I offer personalized care.
I think that's really what drew me to you. We're not all the same. We all have different risks, just like you heard Dr. Vahora say, and really letting your physician hear the problems you're having and troubleshoot through them. What if you did that with a patient and you realized that they actually were at risk for having hormone replacement and that they would have to manage their symptoms some other way? Are there things that people can do?
Yeah, thank you. There's a lot of different options. So there's non-hormonal treatment options nowadays that have come out that's very exciting to treat hot flashes and moods and night sweats. There's other medications that can treat some of the other symptoms. So we take the person and we take the whole body approach. And I have often also work with some nutraceuticals and natural over-the-counter products as well. So I tailor it for the person as to what they want to do. But it's important to talk to the doctor because if you don't talk to your physician about your symptoms, then we can't help you.
That's right.
And it's great that you in your practice listen to women and take the time. We both have boutique practices, which I'm very excited about and excited about working with, because in a boutique private practice, we can take the time to listen to our patients.
That's absolutely true. I wanted to start our session today by asking you something else, which I skipped over, so I'll circle back.
Okay.
What drove you to medicine, particularly in the way that you do it, like in a boutique setting? What was the deciding factor? What was that journey like for you?
Well, I got accepted into medical school early from high school, so I was very fortunate. I have a lot of physicians in my family, so that career was something that I wanted to do in medical school. And then I didn't know what exactly I wanted to do, but then I realized that when I did my OBGYN rotation, I love taking care of women in all stages of their life, right? We did obstetrics, we did, the gynecology, and I fell into gynecology because I love the surgery piece. I love the surgery, but I also like taking care of the whole body for the women. And then when I finished my fellowship, I did a fellowship in minimally invasive surgery and pelvic surgery. I was looking at different options and it just kind of fell in my lap. I got recruited to the area by someone who said, you know what, we can help you set up your own private practice. And At that point, it was kind of scary to start your own practice as a private practice. Many physicians and practices now are hospital owned or corporate,
Mhm.
and it is a very unique position to have a private practice, but I love what I do and I would not change it. I think private practice is a dying art, but I think there's a resurgence because patients are demanding that level of care rather than corporate medicine.
What do you think makes a good patient? Like when you think about people joining your practice, what helps their success with you, that relationship piece, or what is it about certain people that help you help them?
Well, I always tell the patient, so in my practice for the last several months, I always listen to the patient. We've been actually giving patients index cards, and it actually asks them what their goal for today's visit is. And then that way I can set the tone for the entire visit. Like I may be focused on someone's anemia and hemoglobin of 8, but they're more worried about their libido. So I want to make sure that I address everything. So we ask the patient like what their goal is for today's visit, and we focus on that. But it's about communication. So it's important for the patients to communicate. I love it when they come with a list of questions and we can kind of kind of work through those lists. Um, when you come in, I would recommend that you have a list of questions that you want to ask
Mm.
so that we can have communication. And I always tell my patients, my job is to provide options to you, and you tell me what works best in your lifestyle.
I love that customized care piece. It's really so important and critical for people to be listened to and to get to their goals with knowledge, with somebody who
Absolutely.
really knows what they're doing and not just offering procedures or offering medicine or there's so many people that go online and can order X, Y, and Z without any oversight or any idea of what their risks are. I hope we can get you back sometime to go into some of these pieces a little bit further. Not just hormones. Weight loss is a big thing for women's health right now. I'd love to have you back for some of those
I'd love to
topics.
continue this conversation. Thank you
Thank
very
you.
much.
Thank you.